Hello, this is Dr. David Green, CEO of the Texas Pain Network. Today's topic are the top 10 things you should know about stem cell procedures. Now, stem cell procedures for musculoskeletal conditions are now a reality. All right, anywhere you look in sports, it's amazing how many people have had it. Heinz Ward, people like Bartolo Colon, people from the Dodgers, Tiger Woods, Rafael Nadal have either had stem cell procedures or PRP therapy. The first thing to know is that modern stem cell procedures have no ethical issues. There's no fetal tissue that's used. It's only adult stem cells or amniotic-derived stem cells from consenting donors after a C-section. All right, the amniotic fluid after a C-section is discarded. Okay, so now it has a tremendous amount of stem cells in it. It can be used for processing at an FDA-regulated lab and then utilized with stem cells for treating musculoskeletal conditions. Second thing to know is that they're showing immense promise for all these things: degenerative and rheumatoid arthritis, SI joint and spinal joints, disc problems, tendonitis in the Achilles, rotator cuff, elbow, plantar fasciitis, ligament injuries, sports injuries, diabetic wounds, stress fractures. All of these have been showing excellent results in small studies. The third thing to know is that stem cells are truly like a blank slate. They start from an undifferentiated state and they then convert into any number of necessary cells. And a lot of it depends on what type of environment they're injected into, but they can turn into skin cells, cartilage, tendon, ligament, muscle, all these various cells. The fourth thing to know is that they really can heal injury as opposed to just providing a proverbial band-aid like cortisone treatments. The regenerative medicine stem cell treatments offer the potential to heal the damaged soft tissue and cartilage. And this is truly cutting edge. It's helping get athletes back on the field faster, helping them avoid surgery, helping people avoid joint replacement surgery. The fifth thing to know is that current treatments do not use embryonic stem cells. The use of adult stem cells in research and therapy is less controversial than embryonic stem cells because their production does not require the destruction of an embryo. Okay, so no embryo, no fetus. Amniotic fluid stem cells are intermediate between the embryonic cells and the adult stem cells. They do have some potential to develop into different cell types. They are not pluripotent. And this is actually a good thing because with embryonic stem cells, they replicate and replicate and replicate. A lot of times they just don't know when to stop, and that's when you can start seeing tumors, but that is not an issue anymore because the adult stem cells just don't, or the amniotic fluid, they don't have that replication propensity. So number 6 is that there are 4 different types of regenerative medicine procedures now. Bone marrow-derived stem cells, where the bone marrow is taken from the iliac crest, which is in the hip area, and then it's processed immediately and put into the problem region. Fat-derived, which is obviously where adipose tissue is used and processed immediately. This is a little bit longer procedure. It's about 2 hours as opposed to the bone marrow, which is more like 30 minutes. Amniotic derived, which doesn't involve your own tissue at all. It involves amniotic fluid processed at an FDA-regulated lab, tested for all kinds of diseases and conditions, and then it's used after it's cryogenically frozen, and then it's injected. PRP therapy stands for platelet-rich plasma therapy. It's an indirect kind of stem cell therapy. Blood is taken from yourself. It's centrifuged, spun very quickly, and then the platelet-rich layer is taken and then injected into the problem area. It actually can pull in stem cells. In and of itself, it has a lot of growth factors, platelets, and other factors that help with healing. The 7th thing to know is amniotic-derived stem cells have several amazing qualities. As I mentioned, it's obtained from consenting donors after a scheduled C-section, processed at an FDA-regulated lab. It has the following 4 things. Lots of stem cells, tons of them. Hyaluronic acid, which is often found in every joint of your body. Growth factors and proteins, as well as antimicrobial properties. So the incidence of infection is extremely low. It's been used tens of thousands of times worldwide for everything from joint injections to wound healing to ophthalmology and so on and so forth. Eighth thing to know is that small studies to date are showing excellent results for the following: knee arthritis, elbow epicondylitis, which is tendonitis, degenerative disc disease, plantar fasciitis, ligament injuries, rotator cuff injury, and then Achilles tendonitis and tears. Ninth is that most of it is not yet covered by insurance. Despite the exceptional results that are being reported, it usually takes insurance companies several years to cover this new technology. So the cost of the procedures will vary. Surgery can be avoided, though. It can save considerable cost and disability. So the procedures may cost anywhere from $700 or so up to $4,000 or $5,000. It just depends on what you're going to have done and to how many joints. Number 10 is that these procedures are outpatient and exceptionally low-risk procedures. PRP therapy just involves a simple blood draw from you. Fat and bone marrow-derived stem cell procedures are autologous. It's your tissue that's taken. Amniotic-derived, it's immunologically privileged. There's no graft versus host rejection. It has a long track record of tens of thousands of procedures to date. There's minimal adverse event potential with any of these procedures. The top non-operative pain management in Texas is through the Texas Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options with the board-certified award-winning doctors. As mentioned, these procedures are typically not covered by insurance. So, if you call to inquire, just don't be surprised if it's presented to you as a self-pay option. But for other traditional pain management treatments, by and large, those are covered. Visit us online at texaspainnetwork.net and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Green with the Texas Pain Network. Your pain stops here.